and today we're going to talk about anti-inflammatory lifestyle and what that looks like and what we can start doing today to start decreasing our inflammation. So we're going to go over a couple of slides. It's hopefully not going to take too long, and then at the end I'm going to stay here as long as needed and answer all the questions. So if we have any papers or write down notes and any questions you might have throughout the slides, and then I'll definitely answer all of them at the end. Okay. So today's objectives is we're going to learn a little bit more about inflammation. What does that mean? What does it look like? What could that develop in my body? What can I do about it? What are the foods that I should be eating and maybe some that I shouldn't be? And what are some goals that we're trying to look for? So inflammation. Inflammation is a huge buzzword right now, right? You're hearing it all over the place, maybe on the radio, if you watch YouTube videos, you read about it, and you kind of just don't know, like, what does that mean and why is that important to me? So inflammation is actually a natural body's response to an injury, okay? So let's say you cut yourself accidentally in the kitchen, or you have a paper cut, or something else happens. The body's immune response is going to flood that area with blood, which causes a little bit of swelling, a little bit of redness, a little bit of pain as it's healing, and a little bit of warmth. Now I say a little bit because after that response and the healing has already taken place, the inflammation should go away and be done, right? However, sometimes we have a massive response of inflammation, and then sometimes we get a chronic response. And it's that chronic that we're worried about. Now, we're going to picture inflammation like a fire. So when it's working really well, the fire is in the fireplace, it's doing its job, it's keeping us warm, then it goes out, and we can go to bed and we can go about our days. When the fire gets really big and out of control, it starts burning down the house, right? It's causing significant problems, and we know about it and we're aware of it. What's sometimes even more destructive is that chronic inflammation in the fireplace is actually those burning embers that we maybe don't notice because they're not engulfed in flames, but they're still burning. And then as we go about our day, something maybe blows into the fireplace and reignites the entire thing all over again without us really knowing. That's that chronic underlying inflammation that we get concerned about, and that can cause significant issues, whether that's heart disease, blood pressure issues, a flare-up of our rheumatoid arthritis, or chronic pain, scleroderma, we have Alzheimer's, diabetes. All of that is contributed to inflammation. So while it's a good response, if it's controlled, it can get out of hand, right, and becomes a very significant issue. So that's kind of what we're talking about. We're going to try and learn about lifestyle changes that we can start making today that will help us decrease our inflammation and help us lead better, more healthy lives with less pain and less medical issues. So we're looking at eating anti-inflammatory foods, being more active and getting adequate exercise. Now, a side note is that if those people with chronic pain or arthritis or back pain or significant issues from their inflammation, sometimes that limits the amount of activity, right, you can do right now. However, as we continue to work, because this is an entire lifestyle change, our inflammation should decrease, the pain gets better, and then with that, we're feeling better, we're able to be more active, releases more endorphins, we're feeling better. It's this massive, nice cycle that we're trying to start. So if we can't do all of these right now, that's okay. We're working at them and coming at them from all different angles. We're also going to make sure we're getting enough good quality sleep. I'm looking for restful sleep. And a lot of us are just not getting that, but we're going to get into that in a little bit. Managing our stress, managing our weight, trying to decrease our alcohol and tobacco use. Inflammatory eating looks a little like this, right? This is our standard American Western diet. Those lovely cheeseburgers and that deep fried French fries that I love to have, and just everything that when you're feeling like eating junk food, you're reaching towards. However, that all causes inflammation in our body and will give us flare-ups in our pain or arthritis or headaches, etc. So then what can we do that's obviously not this that will help us decrease our inflammation? And it looks a little bit more like these two pictures. It's not one size fits all, okay? There are lots of diets out there that are actually anti-inflammatory, and a lot of them are more traditional based. If you can picture back to the way we used to eat in the 1930s, right? Or some of the Aboriginal cultures still eat to this day. It's a lot of whole foods, we're making everything by scratch. We're not driving through a fast food restaurant. We're not buying prepackaged fast, easy foods, just because, as we're going to learn in the future, those tend to be inflammatory. It's definitely higher in vegetable, which is a higher fiber content. It's higher in fat, like omega-3s, or fatty fish, lots of great oils. It is lower in sugar and lower in refined carbs, which overall is going to give us a lower glycemic index, okay? Which means that it's not spiking our blood sugars up crazy, which is not causing a huge spike in insulin, and insulin in and of itself is very inflammatory. And again, our goal is to decrease the amount of processed foods. So let's start with vegetables and fiber. Vegetables, when I'm looking at my plate, I'm going to try and put as many colors on that plate that I can. The colors tell me, hey, I'm rich in antioxidants and phytochemicals, and I'm really good for you, and I can do great things for your body. Definitely well-balanced diet, lots of vegetables, fruit. I'm looking for 4 to 5 cups, okay? 4 to 5 cups a day. Now, a cup of spinach or leafy greens is actually the equivalent of half a cup of the rest of the vegetables, just because the other vegetables are more dense, right? Like bell peppers and peas and such. But overall, a nice goal, if people are number-oriented, fiber of about 30 grams a day is a nice attainable goal. Now, some people that might be coming from a more processed diet, 30 is a goal, right? And it's up here. Some people are already there and say, hey, I'm already doing great. I have lots of vegetables, and that's fine. As long as you continue hitting that 30, not everyone is starting at the same place. But 30 grams of fiber a day is definitely attainable, and that should be one of the markers that we're looking for. What's interesting is that they did a study, and they gave half the people salads before their meal, and then they gave the other half the exact same salad, but with their meal. Now, the people that had the salad before the meal were already hungry, so they ate that entire salad, and they ended up eating 23% more vegetables than their counterparts who had a salad with their meal, and therefore took in more fiber, more nutrients, and had less calories just overall in that meal than their counterparts, right? Because if you're served a salad before, you're going to eat all of it, and you're like, hey, that was great, I'm still hungry. Your main meal comes, and now you're not as ravenous, right? But you still get to enjoy that great protein and vegetables and whatever you ordered, as opposed to if you give me them both side by side, well, now I'm just going to jump into my main meal and ignore my salad maybe until later, and I might get to it, or I might get full before. So just something to think about. If we're making meals at home, or we're going out to that nice restaurant that we like, a nice side salad before we eat our main meal, right? It usually comes out a little bit faster, so you can go ahead and start eating, and again, take care of some of that hunger pain, and also get in nice vegetables before. Some spices and supplements are anti-inflammatory in and of themselves. Who has heard of turmeric? Yeah, it's really big. Now, when you are looking at turmeric or thinking about it, the exact next thought I want you to have is black pepper. Okay? The studies show that if you have the black pepper with the turmeric, it allows you to absorb more of the nutrients and the anti-inflammatory properties in that turmeric than if you just have it alone. So I want them to kind of go together in your mind, right? Salt and pepper, turmeric pepper, it needs to just be there. Ginger. Ginger is also a fantastic anti-inflammatory spice. I cook with all of them. We're gonna go into a golden milk recipe, which is really nice, especially now that it's kind of cool, right? Cold outside. Make this anti-inflammatory drink, warms you up. Fantastic properties, but ginger as well. Sometimes if you're looking into supplements, right, and you say, hey, listen, I don't want to cook with turmeric and black pepper every night. I'd rather take a pill. We have obviously capsules of this supplement available, making sure you're reading the label and it says with black pepper extract, okay, or pepperine. Some of those supplements will also have ginger added into them because of that anti-inflammatory property. Omega-3s are fantastic in anti-inflammatory properties. We get a lot of these from our cold water fatty fishes. Again, there are supplements available. Magnesium, green leafy vegetables, spinach, Swiss chard, avocado, almonds, all those great options. When we're starting to fill our plate with more of those green leafy vegetables and stuff, we're going to increase our magnesium. Some people, again, need a little bit more boost, and there are supplements available. I will tell you, though, right now, that be careful the type of supplement, especially magnesium, that you're looking for and that you're buying. There's about 20 different types. And 90% of them, if you walk into CVS, Walgreens, Walmart, and you just pick a bottle of magnesium up off the counter, you turn it over and it says oxide. Now, oxide is it's everywhere, it's super cheap, it's great, it's super fast, you're not absorbing it, and so it's really good for one thing, and that's constipation. And it's one of my favorite treatments for that. But if you're trying to treat inflammation and you're grabbing a magnesium oxide and you're just popping them like candy because you think more is better, you're going to have issues, right? And then you'll be complaining, oh, I'm just, the cramps and the diarrhea and everything like that. So be aware that there's different types available, and some types are better for certain things, okay? Not saying it's bad, it's fantastic, like I said, for what it's made for, but there are other types available too. In our pharmacy, we carry magnesium citrate, magnesium glycinate, there's malate available, etc. I think magnesium in of itself could be its own lecture because I love it and it's so nuanced. But magnesium, if we're just going from overall health, try and get it from our foods first, okay? Those green leafy vegetables and avocados that we were talking about. Lots of us like to drink tea. And so tea can also be very anti-inflammatory as well. Black teas have been shown to be anti-inflammatory, but the one that really brings home that prize is that green tea, okay? What I like is it's very nice and it comes with tons of different flavors. There's really strong, robust green teas and some that are very light and mixed with white or jasmine, and so there's a green tea for every single day of the week, and everyone can go out there and find one that they like. So that's an option as well. I'll put this up later, but this is a fantastic recipe. This is that golden milk anti-inflammatory that I mentioned earlier. It is made with almond milk with a little bit of coconut or almond oil. And you can see it has that turmeric, black pepper, ginger, bam, right there. And then these are some options as well to kind of kick it up a notch. What I want you to do is simmer them all together. Simmer, do not boil. Simmer for about 10 to 15 minutes on the stove. And then we're whisking the whole time. You can put in the immersion blender if you want, try and mix it up a little bit. Strain it, make sure that none of these chunks come out of it. Pour it into a mug. If you have to, you can share with others. I don't, because I'm, it's just me, so I have the entire golden milk recipe to myself. But it's nice and warm. Serve it into a mug, drink it. It's going to warm your insides. These spices are very warming in and of themselves, and it's an old recipe that's been used for hundreds, if not thousands of years, because turmeric comes from Ayurvedic medicine, the medicine used and practiced in traditional India. Okay. Omega-3 fatty acids. Cold water fish, right, especially good for these omega-3 fatty acids. I'm looking for 2 to 3 servings a week. Now, a serving is about 3.5 ounces. And that can be of salmon, mackerel, herring, lake trout, sardines, albacore tuna, etc. The fish and the omega-3 fatty acids that come from the animal-based have more DHA and EPA than, let's say, a plant-based. Now, for our vegan and vegetarians out there are plant-based options for omega-3s, okay? A lot of flax oil, walnut oils, etc. It takes a little bit more into our body to convert that ALA into the EPA and the DHA, so it's not as strong as an antioxidant just because it takes that much more and you have to convert it, but it's an option, right? So at least that's there. Olive oil. Who has olive oil at home? Yeah. Did you know there's such a thing as fake olive oil? No idea. No idea. So UC Davis in California did a study because they started getting concerned about the different types of quality of extra virgin olive oil that's out there. Now, extra virgin is a label that they will put on some olive oils, and it means it's minimally processed. So they try not to refine it too much. It's really, pure, and it has, because of that, the most anti-inflammatory properties as well as phytochemicals, the really good stuff. So they decided to test these. I think they tested 124 of them, and they found that 70% were fake, adulterated, not real, not coming to the standards of this extra virgin olive oil that we expected, right? Because I just paid 20 bucks for this black bottle of olive oil from Italy, and you're telling me it's basically worthless. Now, I will say they did find some surprising things that actually passed, and Kirkland Organic. Kirkland Organic can be bought at Costco. It passed all the studies. It is probably one of the cheaper brands. It is an organic, extra virgin olive oil, and now I know where I'm buying my olive oil from now on. Olive oil, because it is minimal, especially the extra virgin, right? The good stuff that we're getting all the antioxidants and the anti-inflammatory properties from, is more fragile, and so has to be cooked at very, very low heat. So do not fry with this, do not saute with this. I wouldn't even put it in the oven. It's really good on salads, really good on top of vegetables, but because it is so pure, once it starts getting too hot, it starts breaking down. So then what can I cook with instead? Coconut oil and avocado oil, some of my favorite other options. These have much higher burning points and so aren't going to start degrading. Coconut oil, again, comes in a couple different types. Most of the time, when you go and buy a jar of coconut oil, it's going to be solid, it's going to be white, and you're going to be kind of grossed out if you don't know what it looks like, right? Because you're coming from the mind of, oh, it should be olive oil and free-flowing, and then it just kind of looks like this gross thing in this jar. Now, you take a scoop out, you put it in your hand, it melts immediately. Okay, so it melts at room or body temperature. So it will, once you start cooking with it or put it on food, it's going to go on, right, like oil. But I kind of like it because it stays solid in the jar, so I can travel with it a little bit easier. So kind of don't let that throw you off. However, they do have a little bit more processed coconut oils out there. So if you like it already liquid, they have those available. A little bit more refined. Some people don't like the taste of coconut oil, and so they have those again. If you refine it just a little bit, it removes some of that coconut flavor, and so you can cook with it and just not have your fish taste as tropically, right? Because it doesn't have that coconut flavor. The other option is using avocado oil. If you guys can imagine how rich and creamy an avocado is, and then you put it into an olive or an oil form, it's lovely, right? Nice and creamy, rich. Again, lots of omega-3s. Higher cooking point, so that's an option as well. We've spent some time talking about things that are really good for us. Let's now jump the fence and say, hey, what are some things that I might be needing to avoid in the future? And then these are not hard and fast rules, right? There is no one size fits all. These are individual. So let's talk about sugar, right? Sugar and its counterpart, refined carbohydrates, are very inflammatory. Refined carbs are your pastas, your breads, your everything I love to eat, bagels, just name it, it's probably a refined carb, right? Turn into sugar in your mouth, and it takes about 4 to 5 seconds. And then it automatically sends a signal to your brain, ooh, that's sugar, I like it. And then it makes our blood sugar spike up, and then our insulin comes up, which is very inflammatory. And then because the insulin is trying to bring down our blood sugar because it's gone crazy, right? Because we just ate sugar, then we crash 3 hours later, and that's when the little monster in your brain says, hey, don't you want a Snickers? And then we start the whole process over again. So sugar and refined carbohydrates are very addicting because of that, right? It's the cycle that we're in. We love it, sugar goes up, then we crash, and then we need some more, and so we're going up and down and all over the place. Trans fat foods, refined seed vegetable oils, which are the ones, the counterparts to the nice oils that we just talked about, have higher amounts of omega-6s, a little bit of dairy, processed meats, and charring our foods. So, right, donuts, breads, all that good stuff, flour, rice, bread, pasta, break down into simple sugars, which spike our blood sugar, which then cause inflammation, and because of the insulin. So our goal is to eat a lower glycemic load. Now, that, if you Google glycemic load or glycemic index, it breaks down food into numbers, and it will say, a single slice of white bread has a glycemic index of 70, which is very high. So then you go, oh, no problem, I only eat wheat. So then you switch the page and you say one bread, whole wheat, slice, 69, right? So we're having some issues with, white versus wheat versus all that good stuff. Now, do I want you to go out and stop eating carbs entirely? That's a whole other story. However, it's unrealistic, right? I'm sitting up here and I know how bad sugar and refined carbs are, but do I sometimes have a Reese's egg because it's Easter? Yes. Do my coworkers enable me? Yes. But again, it's a different story. So I'm saying that this is all just ideal. We're going to try our best to, again, put our healthy foot forward. But I don't want us to get too bogged down in this. I don't want this to give us anxiety about, oh my gosh, I can't have that anymore. We're just going to be more aware that certain things might do or give us issues in the future. So complex carbs, on the other hand, so more of your, if we're thinking barley or millet or even a sweet potato or quinoa, something like that, right? More of your hardier carbs. If you mix that with a little bit of fiber, right, from our vegetables and a little bit of that healthy oil from the fats, right? Sprinkle that omega-3 avocado oil and stuff, is going to slow down those sugar spikes, right? And so you're not doing this as much. Maybe you're going on a smoother roller coaster. So that's an option as well. Trans fats foods, hydrogenated oils. Can everyone see this beautiful poster over here that has trans fats? If you can't, it probably has every food that you like to eat on it. Chocolate, ice cream, cakes, breakfast cereals, cookies, French fries, chicken fingers, pizzas, ice cream, etc. Most of our processed packaged foods and deep fried foods have trans fats in them, again. And so if we take a kind of step back and kind of turn off the part of our brain that says, yeah, but doc, I really like to eat that, we kind of all understand that these foods, right, under the trans fats, kind of aren't so good for us, aren't so healthy, probably aren't doing the best to make the body as nutritious as it could be. So it kind of makes sense that I should not be eating chocolate cake every day, and should definitely not be eating it 3 times a day, and should not be, etc. Refined seed vegetable oils. So these are higher in omega-6s, and some of them are soybean, sunflower, grapeseed oils. And the problem with omega-6s is that they're rampant in our Western diet, okay? Now, back when humans were evolving, we used to eat a ratio 1-to-1 equal omega-3s to omega-6s. Nowadays, because of all the processed foods and the standard American diet, we are eating 10 to 25 times the amount of omega-6s to omega-3s. And that's why we don't need any more of these refined seed vegetable oils, because they're already too high in omega-6s, which we get every day, and we need to bump up our omega-3s. Now, for some people, dairy can be inflammatory. I know that's a whole other thing. I don't mean to, turn anyone off of it, but it does, because of the sugars in it, some people just can't tolerate it. Sometimes it upsets their stomach. Processed meats, right? Hot dogs, sausage, salamis. I love a charcuterie board, right? Your meats and your cheeses, and again, a little slice of bread. It's like heaven. But again, I don't want you to choose the processed meats every day. Instead, we're trying to go for grass-fed, right? Grass-fed beef, other options out there that maybe don't have as much processed stuff in there. And again, charring our food, and that is a lovely picture of burnt chicken, if you can't tell, increases inflammation and is possibly carcinogenic. Other goals. Okay, so we spent a lot of time talking about food. Other goals in our life is we're going to be more active, right? Now, being active in and of itself decreases inflammation. It also decreases our anxiety and stress level, helps us sleep. I mean, the whole thing, I love it. Our goal is 150 minutes a week. Now, it sounds like a lot, but if you break that down, it could be about 30 minutes 5 days a week. It's not so bad. Again, not all of us are ready for that, so I want you to start where you're at now and build yourself up, okay? Please do not go out tonight and start planning for a marathon and then come into me and say, Doc, you told me to run, and I ran, and I wasn't, because then, we'll be talking about your back pain and your knee pain and, how you slipped on the ice. So start where you're at now. Is that walking up and down the stairs at home? Is that walking for 5 minutes, even 10 minutes every day? Start taking your dog out for a walk. Whatever that looks like, start where you're at and build yourself up. Our goal is also to get about 2 days a week of strength training, whether that's a Bowflex at home or picking up heavy boxes, or if you have one of those weight machines, resistance bands are amazing, right? You can fold them up really small, you can travel with them, and you can do all of the exercises that you could normally do with weights, except you just do it kind of with this rubber band, and they come in different strengths, so that's an option as well. Sleep. Who gets enough sleep? Hey, we have 2 people. That's more than last time. I've never been able to raise my hand for those questions, but I applaud you. It's very hard, and it's something that all of us need to be working on, okay? Not only the amount of sleep, but the quality of sleep. If we're not getting enough sleep, it's definitely increasing our cortisol levels, our stress. It causes increase in inflammation. It can cause pain. It can cause hormones to kind of go out of whack. It definitely increases blood sugar, so it's a problem for diabetics. And for those of us that are trying to lose weight, because of the extra stress and cortisol and the blood sugar crazies, and we're just not getting enough rest, it's going to cause weight gain, or at least lack of weight loss, if that's your goal. When we are sleeping, it allows our body that time to rest and heal and repair the tissues and grow, fabulous new dendrites and memory cells. It just helps with everything. We're looking for 7 to 9 restful hours of sleep. Now, some people actually don't need that much. They say, Doc, I sleep for 6 solid hours. I wake up without an alarm. I feel great. I'm totally rested and ready to go. If you are those, A, I need to know your secret, and B, congratulations. That's our goal, right, is to wake up feeling refreshed. I don't need that alarm. I slept all I needed. I woke up naturally. I'm ready to go. I don't take naps in the afternoon, all of that great stuff. But again, we're going to start where we're at now and build up to those sleep goals. The other thing that can inhibit proper healing and cause inflammation is stress. I I've never met a person without stress, so I'm not even going to ask that question. There are multiple different types of stress. Physical stress is when you are walking down an alley and someone out of nowhere pops out at you, right, with or without a knife. It's just very scary. And then emotional stress, you're having a fight with your best friend, right? You may be feeling socially isolated. You are just not feeling connected like you want to, is very emotionally taxing. Mental stress, whether that's at work, right, or financial problems, something that is causing us stress in the background. All of these are issues if they're not properly taken care of. Now, stress is natural, right? When that person turns around at me in the dark alley, I want my body to go into that fight or flight mode, right? So I can run out of there. I'm not really a fighter, but I'll see you on the other side as I run away. But if my body doesn't have that proper stress response, I can't do that. I'm not making it out of that alley. But just like inflammation, once that situation is done, we want that stress to go away. It's done, we dealt with it, it needs to go where it needs to go, and we need to deal with it. Now, chronic, ongoing stressors that we are not dealing with gives us that inflammation, gives us those issues that we're thinking about at night instead of sleeping, right? Causes increased stress and anxiety. So we need to find some way to battle stress. Unfortunately, that's very difficult because each individual person has their own individual stress mechanism, right? I might like to journal, write about it, I just get all my thoughts out, I feel so much better, I can just go about my day. Some people are like, I can barely get down 3 words, so instead I like to paint, right? Some people like meditation, yoga, Tai Chi, progressive muscle relaxation, which is really cool because you can do it in bed right before sleep, and you just progressively go down the body and you're thinking about relaxing each of those. Google it, it's really cool. So that's an option. But again, there are so many stress relief techniques out there that you have to find what works for you, and you have to do it. Because if we don't, the stress will continue to overtake our lives, cause inflammation, pain, anxiety, and then we're just, everything's up, right? And it's horrible. Now, I always save this for last because if we're eating the way that we want to, right, and we're nourishing our bodies, and we're avoiding the things that we shouldn't be eating, like just basically sugar, if you just cut out sugar, right, from today, and we're being more active and we're getting enough sleep and we're managing our stress, the weight takes care of itself, right, without doing anything else. The weight tends to tell us that something else is happening, whether that's a hormonal imbalance or stress or other issues. That being said, a weight loss of about 10% of your body weight will significantly decrease the inflammation already going in your body. So it's nice if we can lose it. It's difficult, right, to lose it unless we're taking care of all these other issues. So in summary, we're going to try and do all of these things, right? Being active and changing our diet, managing stress. I want us to concentrate on spending more time doing what we love with the people we love. I also want us to understand that your inflammation did not happen overnight and cannot be treated overnight. This takes weeks, right, to start doing some of the things that we've been doing for years. And so just be patient. This will come. It is a constant work to try and be a little bit better, to deal with our stress, sleep a little bit more, take care of ourselves, eat a little differently, etc. These are some of my references. Did want to let you guys know that we have started a podcast, Amy Sapola and I. Amy is the clinical pharmacist here at St. Elizabeth's, and she has done the exact same fellowship in integrative medicine that I have. And so we're very close, and we have, I think, fantastic ideas. So we decided to put out a podcast. So just wanted to let you know it is called Whole Health Radio, and it can be listened to online, but it can also be found in your podcast apps if you want. We put out an episode about once a week. Future lectures, like we talked a little bit about before, we do have 2 more planned. However, since these are doing so well and people seem to be responding, I would love for this to continue on. The managing chronic pain is happening in early April, and then in May I'll be talking about dry needling. Definitely, I think you can sign up on your way out if you're already interested, but also look forward to different marketing about these times and dates, because they're still kind of in flux because we're having such a huge turnout. On your evaluation forms, on the bottom, it will ask for any ideas of different topics that you guys might want to hear about. So these, I've just listed some of them. Obviously, they're not all of the topics. So if you have something that you would like a little bit more information on, definitely write that down. But some of them are up here, and some of them can be, menopause or stress relief or high blood pressure, diabetes, Alzheimer's, CBD oil, etc. And I think that's it. So thank you guys so much for coming out. And what questions are there? Yes?
What about caffeine in the diet?
Yeah, caffeine. So caffeine is difficult because we are getting a little bit, right? So green tea, if we're going to start there, is very anti-inflammatory. It does have a little bit of caffeine in it, but obviously not a lot like coffee or espresso or something like that. Coffee has some fantastic properties in them because they have antioxidants and other phytochemicals from the coffee beans themselves, but they don't prove to be anti-inflammatory, really, like the coffee and stuff. However, we like it, right? It's that caffeine. We feel like we need to get it throughout our day. I would be very cautious, though, because too much of a good thing, right? And especially if we feel like we're needing it or we're addicted to it, can cause issues. Now, caffeine in and of itself can cause trouble sleeping, right? And if we're not sleeping, we're having inflammation problems and then pain and then, etc. Caffeine can also cause an increase in stress, increase of depression and anxiety. We're just not able to, kind of come down after being ramped up so high because of that caffeine. So while I say it's not necessarily horrible, right, because like I said, green tea is anti-inflammatory and does have a little bit of caffeine, I would not go out and say, you could totally have 7 espressos and not have a problem. You know what I mean? So I'm kind of somewhere in that middle, but it's everyone's personal journey, yeah. But great question. Yes?
So kind of the diet here for this inflammation would help with high cholesterol?
Yes, so question of, would this overall anti-inflammatory diet help with cholesterol? Is that correct? Yes. So cholesterol in general is also very interesting because we're just seeing new studies and new thoughts about it and how to treat it and all that good stuff. I will say without a doubt, if you decrease sugar and decrease your refined carbohydrates, your triglycerides, which are very inflammatory, are going to go way down, and your medical provider is going to go, whoa, right? And so that's a good thing. Without medication, without anything, you can be in charge of your own triglycerides. Some of these things, like having more of those omega-3s and being more active and trying to decrease that stress and inflammation, is going to actually boost your HDL, which a lot of people call the good cholesterol, right? And so now we're already on 2 things where the triglycerides are going down, excellent. The HDL is going up, excellent. The LDL, which some people call the bad cholesterol, is the one that we're having multiple studies telling us to go at different directions. The other problem too is that there are a small percentage of populations that we call hyper-responders, and so that just means that their cholesterol actually responds too well or too much and can go too high even though everything else is going well. And so it's really hard to say, if you follow this, you will not need any cholesterol medicine, or all your numbers will look great. I think if you follow this, that everything in your, you're going to start feeling better, decrease inflammation. I think your cholesterol levels will look better, but I can't tell you, if this is going to be a totally, medication-free card, if that makes sense. Does that kind of answer the question?
Yeah.
Okay, good. Yes.
the golden milk, you can drink that at night.
Absolutely. So I'm going to put it back up. The golden milk, she wanted to know if you can drink it at night. And I love drinking it at night because it's nice and warm, right? And we kind of have a warm beverage right before. Did I go too far? Yeah. Thank you, because I'm not paying attention. But yes, I love it. I drink it, throughout the day. If, instead of a coffee or a tea in the morning, if we're going to have a nice warm beverage right before, right before bed is totally fine too. If you are one of those that get up multiple times throughout the night to go to the bathroom, maybe drinking right before bed is not for you. So just, again, everyone is kind of personal. So if it's, if you are one of those that cannot drink right before bed or else you're up 3 times, don't do it. Move it up to right before dinner or have it in the morning, however else.
We'll post this on Facebook too.
Yeah. Yes.
You had a recommendation with regards to avoiding the magnesium oxide. Is there an omega-3 fish oil capsule that we should take and others to avoid?
Sure. So, and it's not necessarily avoid magnesium oxide because, like I said, I think it's great for that problem, right, that we kind of talked about. But the question was more geared towards, are there types of omega-3s that I like or maybe would recommend as opposed to others, correct? Okay. I will say, I think our pharmacy does a fantastic job of stocking really high quality brands because there is a difference between supplements out there. If you go to the vitamin store and you're looking for omega-3s, you're going to have 25 different choices and you just don't know which one to get. It is very common that you can get oxidized omega-3s, and that is what you don't want. And you can kind of tell when you open the bottle and it smells kind of off, right? It smells kind of rancid, and you're like, ooh, that sounds gross. I'm going to put that in my mouth. Maybe it smells a little too fishy. Those are the things that we definitely don't want. Now, there are maybe, unfortunately, lots more brands that fit under that category. The ones I really like, and we carry them here, are Nordic Naturals, because even though I teach this and I love it and I love supplements, I'm not a huge pill taker, so I want my bang for my buck, right? I like Nordic Naturals Pro Omega 2000. It is 1,000 milligrams, which is a gram per capsule. And so if we're going, and the starting dose for anti-inflammatory, depending on how severely we're inflamed, is anywhere from about 3 grams a day. We could do 4, some need 6. So you're only looking at 3 capsules a day, as opposed to other brands are only putting in 300, 400 milligrams per capsule. And then you're like, oh, fantastic, I calculated it, and I need 26. So that's when I say, okay, let's go. I'm going to get the big ones. I'm going to get the, things like that. But again, everyone's a little differently. If you don't mind taking capsules, then, there are other options out there. I would say if we already have omega-3s at home, take a look at that nutrition label. Read the serving size. That's going to tell you 1 capsule, 2 capsules, 3 capsules. And then go down and it will say total omega-3s. And it will tell you the amount. Now that amount that it's telling you on that label is the total amount for that serving size. So if it says 1,000 milligrams, but the serving size is 3 capsules, then you have to take 3 capsules to get that 1,000 milligrams. Does that kind of make sense? Because it confuses a lot of people, right? Because you're like, there's too many numbers, I have no idea what I'm doing, I'm just going to take one. Well, one is now giving you only 333 milligrams. So it takes a little bit of math, but that's why I kind of just, I go straight to Amy Cipolla and our fabulous St. Elizabeth's Pharmacy, and I say, give me the good stuff. And so we carry it. Yeah. Great question. Yes, sir.
Magnesium, is that provided by Epsom salt?
Yeah. So magnesium, he wants to know if it's magnesium is found in Epsom salts, correct? Yes. So magnesium sulfate is found in Epsom salts, and it's fantastic. you can absorb it through the skin, and it helps for muscle relaxation, the calming down of the nerves, right? So of restless leg, numbness, tingling, all that good stuff. I love to put Epsom salts in my warm bath and just kind of soak in it because that's a great way of absorbing it. They also make magnesium oil. So you can put, some comes in a spray bottle, pour bottle, whatever. You're able to put that magnesium oil directly on maybe where you're having pain or that numbness and tingling or muscle cramping, and it helps as well. Yes?
What's dry needling?
Yeah, dry needling. So dry needling is something that we use for muscular fascial, connective tissue pain. And I take acupuncture needles, so they're the smallest on the market, right? Really, really super thin, and there's nothing that goes through it. That's how thin it is, and that's why it's called dry needling, right? Otherwise it would be wet needling, and that exists, but it's, again, come to the lecture and we'll talk about it. But I put the needles into the muscle points, the tender points that you're having, some of those spasm points, and it helps to rewire the muscle to let go of that pain and to let go of the nerves that they're kind of sending all those chronic pain signals to your brain for. So it's just another tool in our toolbox that we have here that help us with people with significant muscular pain.
And how does it differ from acupuncture?
Sure. So how does it differ from acupuncture? So acupuncture, you're putting those needles in specific points along meridian lines. And we are trying in acupuncture to open up, right, those chi and let the energy kind of flow and go to a normal balanced state. In dry needling, I don't follow points at all. I don't follow meridians. I go directly for the muscle tender spot that I'm feeling already with my hands, and I use it. So similar techniques, and that we're using, needles. But I am going, we're using them at different points, and then in dry needling, there's also different techniques of pistoning and fanning and trying to relax that muscle in of itself, yeah. Yes?
If people can't use pill form of like the turmeric with black pepper, can they use
Yes,
spices?
fantastic, great question. So if you don't like taking pills, can you choose to take the ground turmeric, ground ginger, all of those other options? And yes, especially with this golden milk recipe. Another way I love to use my turmeric is on roasted vegetables, right? So instead of you're adding your normal spices, and I don't know what kind of spices, instead I take out that turmeric and that's my spice, and I'm making sure that I'm putting that black pepper on it. And so it's a nice way that I've already planned on eating these vegetables. I'm going to put some extra virgin olive oil on it, turmeric with my black pepper, and get a huge double whammy of all that anti-inflammatory stuff. So you can. That being said, the amount sometimes, if we're needing more and more of the turmeric or the ginger and the stuff out there, gets to be a significant quantity, and that's why people say, well shoot, I'm just going to take a pill instead of trying to take 3 tablespoons worth of this spice every day. But that's why also if we're really into these spices, we start finding recipes like this that, hey, how can I incorporate more of these spices into my life? Golden milk, right, on top of vegetables. What can I start doing with this? How can I add it in? These spices have been around for thousands and thousands of years, and so there's tons of recipes out there if you guys can imagine. So yeah. Yes, ma'am.
Can you use the dry needling on like fresh muscle tears or exercise?
Sure.
Or just inflammation?
Yeah, so the question is, can I do dry needling on fresh acute injuries, correct? And specifically muscle tears. Okay, so dry needling I use never on acute situations, just because I'm trying to allow that injury that maybe, let's say you just sprained your ankle or just, lifted something and maybe injured or strained back muscles, etc. I'm allowing that time, right, whether that's a week or 2 weeks, to kind of settle down before I start messing with it, because again, your body is trying that immune response to take care of itself and do its thing. So if I start going in there and messing with it, then I'm just kind of just standing in the way. So usually I let it settle down for a bit, and then I kind of come in and see what I can do. Yeah.
If I'm looking for a cereal in the grocery store that's high in fiber, what do I have to watch out for? That it might have that wouldn't be so good. Anything?
Cereal. Thank you. I was going to say, oh my gosh, you're not going to like my answer. So the question was, I'm looking for a high fiber cereal in the grocery store. What should I be aware of? And unfortunately, because I was being a smart aleck, I said cereal. Because, right, as we can remember, cereal, just because of the high refined carbs it has, because it tends to have trans fats, right? A lot of those breakfast cereals and breakfast foods in and of themselves have that. So I'm just not a fan of cereal because it's a quick, easy way of getting a bunch of sugar in my body, which, you know, I love, right? 4-year-olds love it, but it's just not the best for us. So, yeah, was there a question or no?
Oatmeal?
Oatmeal. So oatmeal, steel cut, right? That oatmeal slow cooked is a much better option. Yes. So, absolutely. And some people will put almonds in there, right? That's a nice source of magnesium. And I would say try and increase our protein as well. Protein is going to help you feel fuller longer, right? It's going to help us not crash as much. So definitely protein is my go-to, especially in the morning. Protein, a little bit of fat. That's why eggs and bacon are a huge thing. And so, you know, even eggs just in of themselves, just cooked up, nice, you know, you have your olive oil, your coconut oil, let's say that you cook them in, and then lots of protein. You're getting choline even from the yolk, so it's really good. Yeah.
Dr. Soleil, so some of us take ibuprofen because we've got inflammation due to arthritis, due to an injury of some sort, and that tends to be a common, common treatment. What are some options for individuals that, their stomach can't tolerate ibuprofen? What are some ways that we can minimize or at least downsize the amount of ibuprofen and go with something more natural?
Sure. So when we're talking about switching from someone that's taking ibuprofen, right, let's say for a knee pain or arthritis, and we're trying to go more of this route, more anti-inflammatory, more supplements, how can I do that, right? And what I would say is I don't want you to stop right now. So if you're doing what you're doing, we're going to continue that. And start doing some of these other things as well. When we start feeling better and we're starting to have less pain, that's a good time to then start maybe taking one less of that ibuprofen, right? Because if we are now used to that ibuprofen, which is, it has anti-inflammatory properties, it helps our knees feel better, etc. If I take that away from you and I'm trying to wait until your inflammation magically goes down, you're going to be in significant pain. So I don't want that to happen. So keep taking that ibuprofen, start doing some of these things, maybe start supplementing with that turmeric, black pepper, ginger mix until you're saying like, oh, I think this even feels even better than my ibuprofen, and then start weaning down on that ibuprofen. So you can do it again. I want you to not be in pain, but then we can make that nice transition to more anti-inflammatory as opposed to medications. Yeah, great question.
Can I take the oxidized magnesium along with a good magnesium supplement?
Sure. So you're trying multiple forms of magnesium.
Yeah.
Okay. So are you also wanting to take magnesium in our food form and a supplement form?
I used to take like a powdered magnesium. It
Okay.
really helped with constipation.
Yeah.
I
Yeah.
don't do that anymore, but I'm taking some magnesium capsules.
Okay. Can you take it different
Can
types?
I take them? Can I take both of them?
Absolutely. Okay. So the question was, can I take the different types of magnesium? So we talked a little bit about how different types are good for different things, and you absolutely can. So if you choose to take that magnesium oxide, which is really good to keep us regular, and let's say you only need one in the morning, you can keep doing that, and you can choose to increase the magnesium in our food, or choose to take a magnesium glycinate or malate or something else for other reasons. If you are having headaches or like anxiety or sleep problems, then those other forms of magnesium are going to help that those issues as opposed to the oxide that you're taking in the morning just for regularity. But yeah, mix and match. Yes, ma'am.
If you feel like you need a nap, is that kind of an indication that you're not getting enough sleep? I mean, should you not need a nap in the afternoon or
Right,
whatever?
yeah, so needing a nap, are you getting enough sleep? Now, are you waking refreshed in the morning?
Well, what's weird is sometimes I can get 4 hours and feel better in the morning than if I get 10.
Okay, yes. So what I think is happening is that when you are feeling better at the 4 hours, you might be waking up at the end of your REM cycle, right? And so that's the natural time that our body wants to wake up. And that's what we're kind of going for, right? It's like, oh, I wake up naturally, I'm feeling good, but you're not going to survive very long on 4 hours, right? But if I sleep too long, maybe I'm waking up in the middle of my REM cycle, and that's the worst. I mean, it's all happened to us. We're in the middle of a sleep and we're just like, oh, it feels really good. And then our alarm goes off and it's blaring and it just, the cortisol and the stress goes up. That is definitely not a good way, right, of waking up. And that sometimes puts a damper on the rest of our day. So I think the goal that we're trying to reach is somewhere in the middle, right? I want you to feel like refreshed, right, and waking up at the end of the REM cycle, but maybe getting more hours than 4, but not enough, not 10. So they've actually started making apps for this, and they make kind of bed monitors and sleep trackers, etc., because of these significant problems. If you put in kind of a time frame that you want to wake up, like, hey, I'd love to, wake up somewhere between 7 or 7:30, but if I'm not awake by 7:30, you have to wake me up kind of thing, because I got to go to work. The sleep tracker will learn kind of by your movements and how fast we're going, right, where we are in our sleep cycle. And when your body is ready after that sleep cycle, anywhere in between 7 and 7:30, it will wake you up. And so then you kind of, I'm waking up feeling refreshed. It's within my time frame. I'm not going to be late to work, but I feel really good. So those do exist because of that problem. As we kind of do more sleep training, right, with our bodies, and we're allowing ourselves enough time to adequately rest, and we're decreasing our stress levels, etc., that naturally happens. But if we're in a hurry, there are nice little apps and tricks and trackers out there that exist for that issue. But yeah, I think that's what's happening. And that's why you feel like you're crashing and you need that afternoon sleep.
I have puppies that need to go out to go to the bathroom every few hours too. So
Yes, absolutely. Puppies will wake me up every 3 hours, and they're like, hey, it's time to play. And I'm like, hey, it's 3 a.m. And they just don't understand. So I feel you, yeah. Excellent. Well, thank you guys so much for coming out. Great questions. What I'm going to do is, if everyone that signed in and